We are very happy that our paper, Closure of Gastric Mucosal Defect using the reopenable clip over the line method to decrease the risk of bleeding after endoscopic submucosal dissection, a multicenter propensity score matched case control study was accepted. My name is Tatsuma Nomura. I'm corresponding author and endoscopist at Suzuka General Hospital, Japan.
My name is Shinya Sugimoto. I'm first author and endoscopist at Ise Red Cross Hospital in Japan.
The LORM technique really stands out in this study as innovative solution for reduced post-ESD bleeding. The results show a post-ESD bleeding rate of only 1.8% in the LORM group compared to 7.7% in the non-closure group, which is statistically significant improvement with a p-value of 0.02.
Yes, and what's remarkable is that LORM achieved a complete closure rate of 100% of 168 regions, even for large mucosal defects. The mean defect size was 45 mm, and yet the procedure required an average of just 33 clips and took only 35 minutes. That's quite efficient for defects of that size.
Absolutely. Another key advantage is that LORM does not require endoscope removal or reextension, nor does it need specialized equipment beyond the reopenable clips and nylon line. This simplicity makes it highly cost-effective, especially compared to other closure methods that often involve expensive devices.
And let's not forget its performance in high-risk patients. For individuals with elevated BEST-J scores, who typically have a predicted bleeding risk of 11.4% to 29.7%, LORM kept the bleeding rate remarkably low. In this study, the LORM group included 56 patients with a BEST-J score of 3 points or more. It's a game changer for managing these high-risk cases.
I agree. Furthermore, LORM reduced the discontinuation rate of antithrombotic therapy from 82.9% in non-closure group to just 9.8%. That's crucial for patients relying on these medications, as it minimizes the risk of thromboembolic complications during a perioperative period.
And by achieving robust closure of mucosal defects, LORM also eliminates the need for second look endoscopy in most cases. This not only reduces costs, but also lessens the procedural burden for both patients and healthcare providers.
Exactly. What's more, LORM overcomes the size limitation of traditional closure methods. It effectively manages larger defects, unlike other techniques that often struggle with anything over 40 mm. This scalability makes it even more attractive option for endoscopic practice.
Yes, and the lack of specialized hardware means it can be widely adapted in clinical settings. Further studies could explore its economic advantages and refine its indications. But this study already positions LORM as a practical and reliable solution for post-ESD management.
In conclusion, LORM fills a clinical gap in current closure methods. Its efficacy, effectiveness in high-risk patients, and cost-benefit make it highly promising too. It has the potential to become a standard practice in advanced endoscopy, especially as we continue to refine its applications. Thank you very much for your kind attention. We would be delighted if this LORM closure provides useful in your clinical practice.